Hello friends, welcome to Health Wizac-Medical Concepts Simplified. In this video, we will learn about acid-base disorders. Acid-base disorders are generally of four types: metabolic acidosis alkalosis and respiratory acidosis alkalosis. The main diagnostic tool to diagnose them include ABG and electrolyte test. To understand about ABG basics and ABG interpretation in detail, please click on the I button at the right top corner of screen or click the link given in the description below. Metabolic acidosis is a condition in which bicarbonate is less than 22 milliequivalents per liter and pH is less than 7.35. Metabolic acidosis results either from addition of acids or loss of bases and can present with normal or high anion gap. Addition of acids may be due to overproduction of H+ ions, ingestion of H+ ions or acids, or failure of kidneys to excrete them. Common causes of addition of H+ ions or acids include alcoholic or diabetic ketoacidosis, lactic acidosis, salicylate poisoning or renal failure, whereas loss of bases may be due to diarrhea or renal tubular acidosis. Symptoms of metabolic acidosis include breathlessness, arrhythmia, confusion and headache. Treatment of metabolic acidosis includes: first, treating the underlying cause; second, soda bicarbonate infusion. Soda bicarbonate infusion is indicated if pH is less than 7.2 or bicarbonate falls below 10 milliequivalents per liter. Amount of bicarbonate required is calculated by formula desired bicarbonate minus actual bicarbonate multiplied by 0.5 multiplied by body weight in kg. It is always recommended to partially correct metabolic acidosis and not fully. Risk of soda bicarbonate infusion includes hypernatremia and volume overload, and hence it should be used with precaution in patients with congestive heart failure and renal failure. Apart from this, hypercapnia, hypokalemia and hypocalcemia can also occur with soda bicarbonate infusions. Next is metabolic alkalosis. Metabolic alkalosis is a condition in which bicarbonate is more than 26 milliequivalents per liter and pH is more than 7.45. It primarily occurs due to loss of H+ ions or administration of bicarbonate ions. Important causes of metabolic alkalosis include vomiting, use of diuretics, blood transfusion, hypoaldosteronism and soda bicarbonate infusion. Symptoms of metabolic alkalosis include headache, carpopedal spasm, arrhythmias, muscle weakness and hyperventilation. Treatment of metabolic alkalosis includes the following points. First, treat the underlying cause. Second, volume correction in case of dehydration, correction of hypokalemia in case of low potassium. Infusion with isolate G or isotonic saline mixed with potassium chloride are recommended. Proton pump inhibitors to minimize the H+ ion loss from the GI tract. Dose modification in case of patients who are on diuretics. Avoid soda bicarbonate infusions. Dialysis and surgical intervention in case of pituitary tumor or adrenal tumor leading to hypoaldosteronism. Next is respiratory acidosis. Respiratory acidosis is a condition in which PaCO2 is more than 45 and pH is less than 7.35. It usually occurs due to increased carbon dioxide production or retention of carbon dioxide due to reduced alveolar ventilation. Causes of respiratory acidosis include respiratory diseases like asthma, COPD, ARDS and pneumonia. Apart from this, neuromuscular disorders like myasthenia gravis or myopathies are also responsible for respiratory acidosis. Drugs like sedatives and anesthetics, traumatic conditions leading to rib fracture, pneumothorax or hemothorax. Symptoms of respiratory acidosis include headache, confusion, daytime drowsiness, myoclonic jerks and memory loss. Treatment of respiratory acidosis include treating the underlying cause like respiratory diseases with bronchodilators in asthma and COPD. Oxygen therapy should be considered in acute cases only and it should be used cautiously in patients with chronic CO2 retention. Apart from this, mechanical ventilation should be considered in patients with CO2 narcosis. Next is respiratory alkalosis. Respiratory alkalosis is a clinical condition in which PaCO2 is less than 35 and pH is more than 7.45. It usually occurs in cases of anxiety, hyperventilation syndrome, normal pregnancy, excessive mechanical ventilation, high altitudes or clinical conditions like sepsis, congestive heart failure and neurological disorders. Clinical symptoms of respiratory alkalosis include headache and shortening of breath. Treatment of respiratory alkalosis include treating the underlying cause, oxygen supplementation with rebreathing mask, pre-treatment with acetazolamide in cases of high altitude encounters. So friends, this brings us to the end of this topic. Hope you find this information valuable and applicable in your clinical practice. Please post your valuable comments in the comment section and any specific video topic you want. Please do like and share this video and hit the bell icon for latest videos. Do check our Facebook and Instagram handles for more clinical insights, and for more such informational videos on medical topics, please subscribe to YouTube channel Health Wizac Medical Concepts Simplified. Thank you.